If you're dealing with SI or sacroiliac pain, follow along with me as I guide you through 4 exercises to get you pain relief. Hi, I'm Dr. Alex Hill. I'm a board-certified women's and pelvic health physical therapist. Make sure you subscribe to my channel so you don't miss any more videos on pelvic health and managing your pelvic pain. Sacroiliac pain or SI pain at this joint right here can be a real pain in the butt. If you have SI pain, you might be having pain here directly at the joint, really kind of in the low glute or the butt region, or even in the low back. You might be having low back pain because that SI joint is kind of in line with the lumbar joints L4-5 and L5-S1. That pain can even radiate down to your glute or the upper part of the back of your leg. SI pain is usually on one side, but it can be on both sides. If you have SI pain or dysfunction, you might have pain with getting in and out of the bed, getting out of the car, and going up and down stairs because of that asymmetrical movement. You can develop SI pain after trauma like a car accident or falling on your backside, stepping down hard off a curb or a step and jamming your leg, or if you have hypo or hypermobility, fractures, if you've had a lumbar fusion, and this is also really common during pregnancy. The SI joint is where the ilium part of the pelvis connects to the sacrum at the bottom of your spine. This is a really stable joint and it moves minimally because of strong ligaments and muscles. So although it may feel like it, your SI joint just doesn't go out. The goal of these exercises in this video is to decrease joint and muscle irritation and get you moving better. We're going to go through a set of 4 exercises, which you can do daily. If you have increased pain doing any of these exercises, do them in a smaller range or a modified version that I'll show you, or stop doing them if that doesn't help. Work with a physical therapist to further address your SI pain if you're still struggling with pain or limited mobility after trying these exercises. And just like with any other exercise routine, always get clearance from a medical provider first. Get checked out to see where that pain is really coming from and what's causing it. The first exercise is going to be a glute stretch. You can do this on your back or a modified version sitting in a chair. Lying on your back, you're going to bring your arms out to the sides to make a T. You're going to lift your leg to about 90 degrees and then rotate that whole leg over to the side. You should feel a stretch in your glute on the leg that is rotated over. You can hold this for a minute, or if you're having more pain and this is too uncomfortable to hold for a full minute, you can start with 4 rounds of 15 seconds. You can repeat this on both sides so that you can get both sides of your glutes. Start out lying on your back with your knees bent and feet flat on the floor. Bring one leg up and over so that your ankle is resting on your opposite thigh, and then slowly bring your leg up towards your chest. You can use your hands to support your thigh that you're pulling towards your chest. You can also use a sheet wrapped around your leg if it's hard to reach over to your leg. Relax into this pose, doing some deep breathing. Hold it for a minute, and then you're going to switch sides and do the same thing with your other leg. Cross your ankle over the opposite side, pull your leg towards your chest, and support the thigh under your knee, holding it with your hands. Again, ease into this stretch, do some deep breathing, and hold it for a minute. You can do this once or twice a day. Next is a bridge. I'm going to show this lying down, but if you have trouble getting up and down from the floor or your bed, or you need to do it sitting, I'm also going to show the modified version. For this exercise, you need a small ball, or you can use a rolled pillow, blanket, or towel. You're going to lie on your back with your knees bent, your knees about hip width apart. You're going to place the ball in between your knees. Rest your arms by your side. There are 2 parts to this movement before you even lift your hips from the ground. First, you're going to gently squeeze your knees in towards the ball, and you're going to hold that squeeze as well as gently contract your lower abdominals. You're going to breathe out as you lift up, and then you can reset to what feels comfortable. Again, squeeze your knees in towards the ball, engage your lower abdominals, breathe out as you lift up.
You can hold this bridge for a couple seconds. I like to coordinate it with my breath. So you're going to squeeze the knees, engage the abdomen, breathe out as you lift, and then breathe in on the way back down. You can do 10 repetitions of this exercise and work your way up from 2 sets to 3 sets. Start out with doing this several times per week, but if it feels good to get some stability throughout the day or maybe before you even start your day, you're welcome to do a set of 10 of these each day.
The third exercise is a bridge with a band around the thighs, and you're going to be moving your legs out to the side. Again, I'm going to show this either lying down with a typical bridge, or I'm also going to show a modified version with you sitting in a chair.
For this last exercise, you need a resistance band, and it does not need to be a very high resistance. You're going to lie on your back and then bring the resistance band up above your knees to your thighs. Have your feet flat on the floor. Your knees are not going to be touching, but they're going to be a little bit closer than your hips. Just like with the last bridge, there are 2 movements with this. Before you lift your hips off the floor, make sure you engage your lower abdominals. Exhale as you lift, and then you're going to rotate your knees out. This first version that I'm showing, I'm keeping my hips elevated the whole time, abdominals engaged the whole time, and doing repeated hip openers while my hips are up. An alternative is going to be engaging the abdominals, lifting the hips as you breathe out, and then opening the hips just for 1 rep before coming back down. Again, engage the abdominals, lift up, rotate out, come back down. Doing it this way allows you to reset after each rep to make sure that you're maintaining your core being engaged the whole time. Just like the last bridge exercise, you can do this in 2 to 3 sets of 10 repetitions and doing it several times per week, or again, 1 set daily if it helps you feel better.
These are just 3 simple exercises to start you on your journey of getting some pain relief. Please like this video and subscribe to my channel below for more videos on pelvic health.